And so there have been studies, several studies that have now been done in Denmark and Finland, asking the following question. What happens to people who have an index episode of cannabis-induced psychosis? What happens to them in the ensuing years? And what was very interesting and concerning is that depending on your definition, between 50 to 75% of individuals who experienced cannabis-induced psychosis were re-diagnosed with schizophrenia in the ensuing 3 years. These findings would suggest that cannabis-induced psychosis is a harbinger of schizophrenia.
Welcome to High Five with Dr. Igor Grant, Distinguished Professor of Psychiatry and Director of the Center for Medicinal Cannabis Research at UC San Diego. Each episode will take you on a fascinating journey into the evolving world of medicinal cannabis, as Dr. Grant poses 5 thought-provoking questions to his guest, uncovering their personal journey and unique contributions to the field. Now, here's your host, Dr. Igor Grant.
I'm Igor Grant, Director of the CMCR, and today I'm really pleased to welcome Dr. Deepak D'Souza. Dr. D'Souza is the Vikram Sodhi Professor of Psychiatry at Yale University School of Medicine, internationally recognized for his work on the treatment of schizophrenia, as well as the potential intersections of cannabis and psychedelics in mental disorders. Welcome, Deepak. And before we start, would you mind saying a little bit more about yourself?
Sure, I'm a psychiatrist. I'm originally from India, and the reason I mention that is because a lot of the work, or the initial work on this relationship between cannabis and psychosis, actually comes from India, and hopefully we'll get a chance to talk about that. I am a professor of psychiatry at Yale University. I'm also working at the VA hospital. What I am about to share today does not represent the views of either the VA or Yale University. It's just my own opinion. I became very intrigued in the relationship between cannabis and psychosis going back to when I was a medical student, when I observed a colleague who experienced a significant psychotic break in the context of heavy cannabis use, and that initial impression stayed with me for a while, and that I was fortunate enough to be able to explore that relationship when I became a faculty member at Yale and established a research career.
Excellent. Well, thank you. So today we're going to be talking about the relationships of schizophrenia, psychosis, mental disorders to cannabis specifically. And so you've already answered a little bit about how you became interested in this area of research. Is there anything else you'd like to say about that before we go on?
Yes. So, as a psychiatrist, having worked with people with serious mental illness, I think I would argue that one of the worst possible psychiatric disorders to have is schizophrenia, because it strikes so early in one's life and is often a chronic, unremitting illness. If we think that there are environmental factors that can contribute to either the risk for schizophrenia or environmental factors that impact the course and expression of schizophrenia, and those are modifiable environmental factors, those would be something that would be of interest to us to pursue, because at least at the present time, we can't do much about our genes. So if there's something that we can do about environmental factors, that would be great.
Well, and you mentioned it's a very serious disorder, and our treatments are not perfect either. So that's another good reason to try to prevent this.
Exactly. I mean, the other important issue is that our treatments are not curative treatments. They are treatments that manage the symptoms, which is not to minimize the impact of treatment, but they're not curative treatments. And so if there's a way that we could prevent the illness in the first place, wouldn't that be great?
Exactly. Well, then, on that note, I know that you have done a lot of work, you and your colleagues, trying to sort out what is the contribution of cannabis to possible onset and continuation of schizophrenia. And I suppose the debate boils down to, can cannabis cause this disorder? Is it a cofactor in some way, a contributing factor? So tell us what you've learned, what you think about this.
Yeah, so I think it might be good to kind of set the stage and define some important terms before we
Mhm.
go into any further depth about this link between cannabis and psychosis. So the first thing would be for us to define what psychosis is. Psychosis is typically defined as a constellation of symptoms, including hallucinations, delusions, paranoia, ideas of reference, disorganized thinking, and so on and so forth. These would be symptoms of psychosis. But symptoms of psychosis might actually be part of a larger syndrome that we call a psychotic disorder. And that psychotic disorder, at least the prototypical psychotic disorder, is schizophrenia. So the analogy I would use would be that of chest pain or angina and heart disease is the relationship between psychosis and a psychotic disorder.
Mhm.
So if we think about the relationship between psychosis and cannabis or cannabinoids, one might think about the relationship based on the temporal characteristics of this relationship. Cannabis and cannabinoids can induce transient psychotic symptoms that last for the period of intoxication. So it can induce symptoms of paranoia, ideas of reference, disorganized thinking, and even hallucinations. And these symptoms usually present immediately after exposure to cannabis or cannabinoids and will resolve usually by the period during the period of intoxication. So it may last maybe an hour or two at the most. Most of the times, this doesn't require any kind of clinical intervention. People don't seek out help for this. Now, in this case, given the very tight temporal relationship between exposure to cannabis or cannabinoids and the emergence of these symptoms, I think we can be fairly confident in using the C word, which is causality, that exposure to cannabis followed immediately by psychotic symptoms. We can say there's a causal relationship. Okay. Now, the second relationship might be that of where psychosis symptoms emerge shortly after exposure to cannabis. And in this case, the symptoms last beyond the period of intoxication. So they
Mhm.
may last for hours to days to weeks. They may often resolve spontaneously, but in many cases, people may seek help, go to the emergency room because of these new symptoms of hallucinations, delusions, or paranoia that might emerge in the context of cannabis. In our nomenclature, in DSM-5 or in ICD-10, we categorize this as cannabis-induced psychosis.
Right. And just for our viewers who may not be medical, DSM and ICD are classification systems
Yes.
for diseases, right? Yeah.
Yes, that's a common language that we use in mental health. And whether it's a valid language or not is a different matter, but that we agree on using these terms in a certain way. So in
Right.
our current nomenclature, we would call this cannabis-induced psychosis. And what we know about cannabis-induced psychosis is that it can often recur when a person uses cannabis again or cannabinoids again. It can sometimes require clinical intervention, as in treatment in a psychiatric facility or in an emergency room. It may require medications such as antipsychotic drugs. Now, again, in this instance, there's a tight temporal relationship between exposure and the emergence of psychotic symptoms. And so, again, we can say with some degree of confidence that that this is causal. Now, I I've used the term in so far cannabis and cannabinoids, and the reason I use that is that there are a number of other substances that share many similarities with cannabis. If you think about cannabis, and the principal psychoactive constituent of cannabis is delta 9 THC, which is a partial agonist at brain cannabinoid receptors. We now know that there are many, many more compounds that have been synthesized that have effects that are similar to THC. And we could lump these under the common term synthetic cannabinoids, which about 15 years ago were available recreationally under the name Spice and K2. And these compounds are between 10 and 200 times more potent than THC. And what we saw was that in pockets around the country, there would be people who would end up in the emergency room after using these substances, these spice and K2 like substances. So that's another line of evidence that supports this notion that cannabis and cannabinoids are linked to the emergence of to psychotic symptoms or a psychotic disorder. Now, the second relationship that I spoke about, and that is of cannabis-induced psychosis, there's some very interesting characteristics about that which we are beginning to recognize. As you know, in Scandinavia, so in Finland, Denmark, and Sweden, they have a nationalized healthcare system and they have excellent registries. So you can get health data on all its citizens or almost all its citizens. And so there have been studies, several studies that have now been done in Denmark and Finland, asking the following question: what happens to people who have an index episode of cannabis induced psychosis? What happens to them in the ensuing years? And what was very interesting and concerning is that depending on your definition, between 50 to 75% of individuals who experienced cannabis induced psychosis were re-diagnosed with schizophrenia in the ensuing 3 years. These findings would suggest that cannabis induced psychosis is a harbinger of schizophrenia, we think of as a chronic, recurrent, and persistent psychotic disorder. So, again, just to kind of maybe reiterate, if you experience an episode of cannabis induced psychosis, you are at significant risk for developing a chronic and persistent psychotic disorder, which in our current nomenclature we call schizophrenia. Perhaps 10 or 15 or 20 years from now, we may call it something else. We may call it cannabis-induced persistent psychotic disorder, but that's for another conversation.
All right.
So the second relationship is that of cannabis-induced psychosis, which again, we can use the C word of causality. And then the final relationship is that of exposure to cannabis in adolescence, followed months to years later by the emergence of schizophrenia. Now, for obvious reasons, it is because there is not as tight a temporal link between the two. There is debate about whether you can use the word causal or not. But when one thinks about causality, one is often drawn back to the seminal work of a British physician. His name was Sir Bradford Hill. And Sir Bradford Hill published a number of criteria that we use in the medical profession to establish causality. And the reason it might be interesting for us to talk about it today is because Sir Bradford Hill developed these criteria in the context of the link between smoking cigarettes and lung cancer. So even though cigarettes were around for a very, very long time, and even though physicians recognized in the early 90s of a potential risk between smoking and lung cancer, most people didn't believe that cigarettes could cause lung cancer. And it was the important work of Sir Bradford Hill, who defined these 9 criteria to, for the first time, show very conclusively that there was a indisputable causal link between smoking and lung cancer. And what are those criteria? They include temporality, which I just spoke about, the temporal relationship between the two. How specific is it? What is the strength of the association? So, for example, if you smoke cigarettes, your risk for lung cancer, lifetime risk, is about 20 times higher than someone who's never smoked cigarettes. In contrast, the epidemiological literature on the link between cannabis and schizophrenia is about a 4-time greater risk. So it's not in the same magnitude of risk as, say, smoking and lung cancer. But what's really important is that the landscape of cannabis is continuing to evolve. And what do I mean by that? I think it's very clear to us from both laboratory studies and from epidemiological studies of a dose response, which is one of the other criteria that Sir Bradford Hill proposed, which is the more that you're exposed to an environmental factor, the greater your risk for that illness, whatever that illness is. So the more cigarettes you smoke, the greater your chance of lung cancer. So if someone smokes 2 packs a day versus 1 pack a day, their risk for lung cancer is going to be even higher. And so looking at the dose response relationship between cannabis and schizophrenia, it would suggest that if you are a daily user of cannabis and you smoke high potency cannabis, your risk in some studies could be 6 times higher and 9 times higher than if you've never used cannabis or you use low potency cannabis. And why is this important for us to recognize? Because this is a moving target. The cannabis that was present in the 1960s and 70s wasn't as potent as the cannabis that's present now. The concentrates that are available right now, which could be up to 95% THC, were not available 30 years ago. So this is really a moving target. In contrast, the strength of nicotine or the other constituents in cigarettes has remained much the same over the last decades. So what that indicates is that as we see greater availability of high potency products like concentrates that can be vaped discreetly, we might predict that the rates of psychosis are going to increase as more products like this become available. So dose response was another factor that Sir Bradford Hill proposed. Another was whether there's any research plausibility, whether there's any research to support this. And a number of groups in labs across the world have shown that one can induce psychosis-like effects in healthy individuals with no obvious risk of psychosis. You can induce transient, time-limited, very time-limited effects that resemble some of the effects that we observe in schizophrenia. So there is some research data to support this notion of cannabis and being linked to schizophrenia. In terms of specificity, lots of people use tobacco, but tobacco or smoking tobacco is not associated with schizophrenia, and giving nicotine to an individual does not induce symptoms of schizophrenia, unlike THC. So for many of the criteria, of the 9 criteria that Sir Bradford Hill proposed, I think the evidence for cannabis and psychosis meets the threshold of those criteria. Some, but not all. And as I mentioned earlier, the strength of the association, at least at the present time, is not anywhere close to the strength of the association between smoking cigarettes and lung cancer.
Right.
Now, importantly, very importantly, not everyone who smokes cannabis develops psychosis, and not everybody who has psychosis has used cannabis, just as not everybody who smokes cigarettes develops lung cancer, and not everybody with lung cancer has smoked cigarettes. So that's another way of saying that cannabis is neither necessary nor sufficient to cause schizophrenia or psychosis.
I think the model of Bradford Hill in terms of establishing the link between tobacco smoking and lung cancer is very interesting. One thing some people point out, however, is that kind of the idea that, well, cannabis kind of came into Western societies, at least, as a popular thing, in the 60s. So we've had 50 years, 60 years of experience with this. Surely, if one introduces this kind of poison, if you will, into society, there should be a substantial risk or increase in the prevalence of schizophrenia or psychotic illnesses, at least in these Western societies. Not all of the data support that, do they? I mean, in contrast with lung cancer, there was an actual epidemiologic increase in lung cancer over the 100 years or whatever. But what's your view on that? Or are my data wrong on that
No,
there isn't actually an increase?
I would say the data are quite mixed. The data are
Okay.
mixed. It's very hard to do these kinds of studies in a place like the US, where we don't have a nationalized healthcare system, we don't have excellent registries. But if you look at countries like Denmark, for example, between 2006 and 2016, which is when cannabis became a lot more available in Denmark and the potency of cannabis increased, there was a threefold increase in cannabis-induced psychosis during that time. So there were these two coincidental processes. There was an increase in the rates of cannabis-induced psychosis, and there was an increase in the availability and potency of cannabis, suggesting that the two were linked. So the other point.
But were the rates of schizophrenia increasing? Because
So
as you pointed out earlier, the two are not the same.
they are not the same, but as I mentioned, at least in Denmark and Finland, the two places that they've done studies, it looks like if you have an index episode of cannabis-induced psychosis, you're very likely, depending on the criteria you use, to be re-diagnosed within 3 to 10 years with schizophrenia. One difference between the lung cancer smoking story and cannabis schizophrenia story is, when you think about it, were introduced. Tobacco has always been around. Tobacco has been used by humans for centuries. The game changer was the commercialization of tobacco, where cigarettes were produced were mass produced, were put into packets that could neatly fit in your pocket, that were advertised and marketed very aggressively. And so they've been around for about 100 years or so. We are not quite at that point with cannabis, at least the commercialization of cannabis. It's a relatively newer phenomenon. And even in the US, where we are much further along in terms of the legal landscape of cannabis, with the exception of California, it's a relatively recent phenomenon. And so we may just not be at the right time. It's going to take time for us to recognize. Just going back to the relationship between lung cancer and smoking, most people did not believe that lung cancer was caused by smoking, even though there was very compelling epidemiological evidence. The game changer was, of course, Bradford Hill's criteria, but also the fact that we had a signature pathology of lung cancer. We don't have a signature pathology of schizophrenia, which makes it very hard to study.
Yeah.
That's really makes our job much harder. So I think while there are some similarities between the cannabis and psychosis and lung cancer and smoking, there are also some differences. Hopefully you are right and there's no relationship, or hopefully we don't have to wait for as long as we had to wait for people to figure out that smoking definitely caused lung cancer. That would be really unfortunate.
Well, also, I'd like to point out that I'm raising the counter argument. I'm not here to argue that cannabis is harmless, and there's absolutely no problems with it, obviously. But it's, as you say, a very complex kind of relationship that has to be uncovered. But could I just ask, as a related question, I think what I'm hearing you say is that cannabis certainly could be a triggering factor in the emergence of schizophrenia. And maybe that goes to say, maybe some people who have a propensity in that direction, sort of akin to the woman who becomes pregnant and spills sugar, but is not actually diagnosed with diabetes, how that kind of may predict later onset of diabetes because the stress of the pregnancy dysregulates the whole glucose control. So anyway, I'm not trying to push that example too far, but it's kind of something that maybe brings forward in time a process that might have happened anyway or might not have happened without that stress. Would you kind of agree with that kind of conceptualization? Or?
So before you asked the question earlier, I was about to say something really important, that we think of cannabis as a component.
Mm-hmm.
When you think about most chronic complex diseases, whether it's high blood pressure, whether it's diabetes, these are multifactorial, right? They are multifactorial. We think of the current prevailing hypothesis is that cannabis may interact with genetic risk and other environmental risks, such as childhood trauma, to confer a greater risk for schizophrenia, right? So you may have the genes for diabetes, but you may never develop diabetes. And likewise, you may have the genes for coronary artery disease, and you may not develop that. It has to be a number of different factors that converge, and cannabis is one factor. The reason I think it's important for us to consider it is that it is a modifiable risk factor.
Right.
I can't do anything about one's genes, at least at the present time. If we are able to, for example, if our framework is that cannabis exposure during critical phases of brain development confer a high risk for the development of schizophrenia, then if we can minimize cannabis use during those critical phases of brain development, which happen to be mid-late adolescence, right? We may be able to prevent new cases of schizophrenia. Yesterday on my webinar, similar to yours, I had Marta DeForti from the United Kingdom, who's done some amazing epidemiological work on cannabis and schizophrenia. And what she reminded us yesterday was that in their studies, they calculated something called a population attributable fraction, which is another way of saying how many new cases of schizophrenia could have been prevented if you were able to remove cannabis from the equation. And in one study, they showed 20%, and the other study, they showed 35%. Now, for a chronic, serious mental illness, often lifelong illness like schizophrenia, if you can prevent 20% of the cases, that would be an amazing achievement. And if you talk to family members of people who have schizophrenia, they would say that would be a worthy cause to pursue. So going back to your point, I think that I would be careful in using the word trigger, because one might think about trigger as if you have coronary arteries that are narrowed, and you're doing fine for most of your life, and you suddenly have to shovel a lot of snow in the winter. That would be a trigger. We don't think of cannabis in quite the same way. We think of it as actually contributing to the pathophysiology and not just tipping something over the edge. I would think of shoveling snow as many people shovel snow, but the shoveling of the snow would be a trigger. And I would be careful in describing cannabis in much the same way.
Right, and I think that's a very valuable clarification. I was actually thinking more, some of my work has been in terms of life stress and onsets of cardiovascular disease, things like this. And actually, also in the UK, there was a sociologist, George Brown, who talked about the relationship of life events to both mental and physical illnesses and had the concept of brought forward time, that these stresses may not be causal in the sense that they just make something happen, such as if you have an automobile accident, you have a brain injury. It's not causal in that way, but rather may have the tendency to bring forward in time something else that was perhaps brewing. But I don't know what you think about that.
Well, so the $1,000,000 question is obviously, and I really think I should have said this at the very beginning, because I don't want to be to sound more weight to this than there actually is. The overwhelming majority of people who use cannabis in moderate amounts sporadically don't have any problems from it. That's really important for us to say. So I guess the question is, can we identify who is at risk for developing psychosis? That is the $1,000,000 question. What we do know is that people with a family history of schizophrenia, which is at the present time the most obvious and the only risk factor that we can identify easily, they seem to have an earlier onset of the illness if they use cannabis.
Mhm.
So what I will tell my patients, if they have siblings who are young at an age before which schizophrenia strikes, to try and convince them to delay their use of cannabis until they've crossed that neurodevelopmental, and so it would be amazing if we can actually find what are the exact risk factors that would tip someone over the edge. And perhaps genetics might play an important role in that. There are a number of groups that are actively looking at what genetic factors may interact with cannabis, for example, to confer a much greater risk of schizophrenia. Perhaps in the years to come, as we move towards precision medicine, we might be able to genotype people and say, okay, you have absolutely no risk of using cannabis. And you, on the other hand, there's a 60% chance that if you use cannabis during adolescence, you may develop a serious mental illness. But we are not at that point.
Yes. Well, and it also, I think, raises the complex issue that let's talk about the adolescent who uses a lot of marijuana. That is not a typical adolescent. Why is that person so attracted to it? And is it because they're also, in effect, either self-medicating or doing something? So there's also a propensity maybe to use heavily among people who are vulnerable, which may make the problem even worse.
Sure.
Yeah.
I mean, the genetic studies suggest that there's some, the risk for schizophrenia and the risk for cannabis use may be shared. There's some commonalities there.
Mm-hmm. Yep.
And
Yep.
this may be a bidirectional relationship. That is, if you're more likely to develop schizophrenia, you may be more likely to use cannabis. And if you're more likely to use cannabis, you might be more likely to develop schizophrenia. So it's very complicated, and we have a lot more work to do in terms of getting to the bottom of it.
Well, it also reminds me a little bit about work that's been done in alcoholism, where kids who come from families of parents with alcoholism are more likely to develop these problems if they use alcohol. And so the advice might be, you really have to monitor your alcohol use much more so than somebody who doesn't have that baggage, if you will.
Sure. I agree with that. Yeah.
Yeah. Well, look, you've actually we're going to be coming to the end of our time. I was going to ask you another question, but I think this has been such a good discussion that I'd like to cycle back to what you were alluding to. What is your advice at the moment to physicians, healthcare providers, and for that matter, parents and kids themselves about marijuana?
So I'm going to restrict my comments to the topic that we've been discussing, which is cannabis and psychosis. And I think there's accumulating and converging evidence of a relationship between cannabis and psychosis, both in terms of there's fairly convincing evidence that it can induce short-lived psychotic states. And we believe that if you have a short-lived psychotic state, you may be at greater risk for developing a long-lived psychotic disorder. And what we do know is that those individuals with a family history of psychosis might be more vulnerable and should be careful in using cannabis, especially during formative years in mid-adolescence, around that time.
Yes. Well, very good and very balanced and sensible advice, right? Well, I really want to thank you, Dr. D'Souza, for participating in our podcast. This is a question that probably we could discuss for many hours and still have a lot of questions.
Sure.
But thank you, and thank you for your work and your leadership in this area.
Thank you for inviting me, and I really enjoyed talking to you.
If you like this podcast, please subscribe so you don't miss future episodes. For more information on the Center for Medicinal Cannabis Research at UC San Diego, please find us on social media at CMCR_UCSD on Twitter or X, Instagram, and other social media platforms. Or visit our website at cmcr.ucsd.edu. Thanks for listening.